I know we've had a lot of patients mention Smile Design, but I think until you've actually seen one, you're kind of like, what the heck is a Smile Design, right? So Robin is going to be demonstrating today what that Smile Design really is. So in her case, she was having problems where she didn't really realize this, and I think a lot of people don't, that she was only hitting on one side. And it wasn't really till she started having a problem with teeth that were fracturing, and she was having tooth pain, and then she goes to the dentist and finds out that she has to remove a tooth because it's fractured, and then like another one happened. And I think it really got your attention when it was the front tooth, right? That was like, okay, I'm like losing my teeth and now it's the front tooth. I'm really starting to get nervous, right? So, and at that point, you had met me, and we were working together too, right? And I'm like, we got to really look at your bite. We've got to see what's going on here because we can't have this keep happening, right? So I put her in Invisalign to align her teeth and improve the bite. And so once we had done that, we took care of the teeth that were fractured and had removed those teeth and had bone grafted using our PRP, using our guides for perfect placement, and also ozone. I haven't mentioned ozone, but ozone is basically a supercharged oxygen molecule that helps to kill any harmful bacteria. And also, I mean, even teeth love oxygen. And I find that all the tissues in the body really respond very favorably to the oxygen with using the ozone. And it's basically, you know, a way to kill bacteria and provide oxygen to the body, but without chemicals. So pretty neat to be able to utilize the ozone. But so after we had the implant placed with the surgical guide, then we were really in a healing place for Robin, and she's at the point now where the implants are ready to restore and put a tooth on them, right? Because implants, it takes a while for them to be able to put a tooth on them, right? You have to have the tooth removed, you have to have the grafting, you have to have the implant placed, and that has to heal. And then once it has fully healed, then you can put a tooth on it. So it does take a few months from start to finish in order to have that fully healed. But she's at that point now, and we're ready to explore that Smile Design and what that actually means. So we took a scan, an iTero scan of her teeth, and I had the lab artist then make what we wanted the teeth to look like. So this Smile Design, then we transfer to her mouth so that she can try it in and see if she likes it or not, right? And this is, you know, patients haven't done this before. So I've done it every day, but they don't do it every day. And when you say Smile Design, they're like, well, what does that really mean? And what do I want my teeth to look like when we're done? So this gives them a little bit of an idea of what they're getting and if they're gonna like it or not, you know? So, you know, this is our chance to critique what we're getting ready to do before we've done it. Because with veneers, I don't know, you know, every once in a while someone comes in and they're like, well, I had a smile transformation with another dentist, but I'm not happy, I don't like it, you know, and this is one way that you can avoid having that scenario where you get something that you don't like. So we're going to try it in, and like I said, you know, this is the time to critique it, so it certainly doesn't hurt my feelings if you say, oh, I don't like it, or, you know, or we need to do this, or we need to do that, because this is the time to decide, you know, if you like it or not. So, all right, so Robin has a smile that we're going to restore, and she has a dark area here with different missing tooth that we need to restore, and then tooth number 9 here, this front tooth, a central incisor, we're going to be putting a new crown on as well, but we're going to be doing 10 teeth all together. So you're going to see how her smile looks beforehand, and then we're going to do this little mock-up. This is a little trial, like a smile trial, just to see what we think, if we're going the right direction with this, and if she likes it, or we need to change something. This is the time to figure that out. What we have here is a smile trial mock-up, and we have the stent that fits very tightly over the mock-up, as you see, and we're going to use this little stent, as we call it, to transfer this smile design to the mouth. So what we do is we take resin and we fill each little well with resin, and I just kind of carefully go in each little tooth well and put some resin in there. And then what we do then is carry this mouthpiece to the mouth and put it into the mouth and allow it to set up. And then once it's set up, she'll be able to view her smile design. All right, and then we're going to come to the mouth, and you can see she's not in any discomfort or anything. And then rest your teeth together, please. Thank you. And then I'm going to go like this. Shannon, will you take this, please? You okay, Robin? Mm-hmm. Good. All right, everything's going well. And actually, I'm going to have you open for a moment, please. Thank you. Okay, that's fine. All right, go ahead and rest your teeth together. All right, and your timing is 2 minutes, right, Shannon?
Yes, it's right here.
All right. So sometimes we do a diagnostic wax up just for like maybe 2 teeth or just for 4 teeth. And so those, you know, in her case, we're doing 10 teeth, and the purpose of that 10 teeth is to create a smile that blends and matches with her face too. We don't want teeth that are too big or too small. You know, we look at a lot of these things whenever we're coming up with this smile design. We look at tooth shapes, because certain tooth shapes are more masculine or more feminine, and you know, depending on the size of the person, you know, maybe you need a different size of tooth, you know, for the size of their mouth. And we look at all of those things. And when it's time to look at color, we look at the color of your skin, the whites of your eyes, the color of your hair. And we look at a lot of different details whenever we're looking and doing this smile design and the final touches. But we can do just 2 teeth or 4 teeth, and that can be part of smile design too, because sometimes people come and they don't need, you know, 10 teeth done. They just need 2 teeth done. That's a little harder, requires much more precision with blending and balancing and fitting into the overall scheme of someone's bite and their mouth, but that can be done also too. It's not always 10 teeth or 12 teeth or 20 teeth. All right, so now it's ready to take off, okay? So I'm going to kind of gently peel this back, okay? And then I'm going to get the excess off here. And so I'm just going to kind of grab that, and Shannon's going to come in and help here. And there's a few little pieces whenever we do this, that just little extra pieces, right? All right, so here we are just with Robin's smile design, and you can see like that hole has been lessened, and you know, when I shine my light on it, you can kind of see, you know, this is just to give you an idea of where you're going with this. And of course, this is fitting over her natural teeth. So I would say when we go to make her temporaries and actually do the design, it's going to be even more precise than what it is today. This is just to give people an idea of the direction they want to go.
Much thinner.
And they'll be much thinner. Yeah, this feels kind of bulky, right? Because it's fitting over your teeth.
Yes.
Yeah. But now if I am going to critique it, okay, and you know, this is what I do, right? I would say, you know, it still kind of bothers me, you know, that your front left central incisor is a temporary implant crown, right? Mm-hmm. And that was actually before me, and that was great as a temporary measure. Mm-hmm. However, you know, if we are making that, I feel like that tooth is a little too square, a little too bulky maybe, and I would like to see that ultimately a tiny bit smaller and maybe more rounded, a little more feminine. Mm-hmm. But, you know, looking at it, I feel like the design is getting, you know, close to what you would want, because we're going to fill out the sides. But I think we should kind of continue to work on that, kind of giving it a full design and kind of straightening everything up just a little bit.
So I feel blessed to have Dr. Roberts as my dentist because people come to her. She is a perfectionist and she looks at the tiniest of details from functionality to cosmetic, and she gets it 100% all the time and won't stop until it is perfection for the patient and her.
You know, everybody comes in here kind of wanting something a little different, and I really do like to listen to what the patients tell me that they do want, so I can try my hardest to give them that. You know, some people come in and they want really, really white teeth, and some people come in, they're like, I don't want them so white, I want them to be more natural looking and not Hollywood white, or I want them to be youthful, or, you know, everybody wants something different. And we do have books actually on smile design and tooth shapes that people can look at to help them kind of decide, and of course I help to steer them to give them what they're looking for. And I love it when people bring me pictures. If you can bring me a picture of what you're wanting, that really helps me as well to hone in on your desires so I can help me meet that goal. Because if you don't show me, sometimes I don't know. So, at any rate, but that's kind of what I think about your smile design.
Yes.
Yes.